During a large-scale emergency, when hundreds, even thousands of lives hang in the balance, it's vital that a region's emergency response and healthcare organizations collaborate in a highly coordinated way to assure a rapid and sustained response. In Bethesda, Maryland, a unique emergency preparedness partnership was established to serve those living in the surrounding area. Formed by the National Naval Medical Center, the National Institutes of Health Clinical Center, and the Suburban Hospital Healthcare System, this unique alliance is paving the way for emergency preparedness. One of its principal goals is to integrate and leverage complementary resources to provide an immediate, sustained response to any local, regional, or national emergency. Another key goal is to develop a transportable, proven model for defining best practices in casualty care management. It's one that embraces multi-agency collaboration, integration, and training. The Bethesda Hospital's Emergency Preparedness Partnership, begun in February 2004, is the first emergency response collaboration of its kind. It represents a formal alliance between military, federal, and private healthcare facilities.
What we realized as individual facilities, we would rapidly deplete our resources. But when pooling our resources together, we knew that we would not only have an immediate response for our community citizens, but we'd be able to sustain that response.
In June 2004, the partnership submitted a white paper to Congress outlining its collaborative disaster response model. The model has 5 extremely important initiatives. One of these is to maintain communications capabilities that offer redundancy and interoperability between existing systems. Another is to ensure surge capacity through deployment of state-of-the-art multi-purpose mobile medical shelters. A third initiative of the partnership is to provide rapid and efficient patient transportation between facilities. An additional facet of this unique alliance is to cross-credential medical personnel. The model's 5th initiative is resource sharing, which makes it possible to efficiently and effectively allocate emergency response equipment, supplies, and personnel. Personnel from each institution meet to refine the partnership's emergency preparedness initiatives and to identify future research and development. Since its inception, the Bethesda Hospital's Emergency Preparedness Partnership has made steady progress in achieving its goals. In October 2004, it organized the Collaborative Mass Casualty Exercise, a large-scale disaster drill that was the first of its kind. This unique event involved well over 400 participants, the inter-facility transfer of 125 patients, and more than 20 EMS agencies. With military, federal, and private healthcare facilities taking part, the exercise is now conducted each year, with its purpose being to test and evaluate the partnership's disaster response model initiatives. In September 2005, member organizations formalized their groundbreaking partnership by signing a memorandum of agreement. At this same time, the partnership expanded its disaster response model from the local community to the county level.
And I've been so heartened by the partnerships where each of the partners has had the vision of how do we serve our nation, not how do we serve our individual interests.
There's no substitute for being prepared than practicing together the kind of emergency that we may face.
What we have accomplished here is a single unit that's come together as a team to meet an emergency.
This exercise encompassed 8 area hospitals, 4,000 participants, 400 casualties, 30 EMS units, a local private school, and the deployment of field response teams made up of personnel from the participating facilities.
It's not all of the schematics or all of the moulage victims you see. It's about getting the message across that if we do not come together and all of our agencies train and exercise together, we will not be ready when the real disaster strikes.
In December 2006, The partnership further expanded its model to the region by hosting the collaborative multi-agency exercise, which featured an unprecedented integration of local, state, federal, and military agencies in action.
This is a joint effort between the military, between the state, between the federal entities and government, between the local municipalities. This is an effort that is going to be necessary in order to make sure that we can do what we need to do for our people, the people of the United States.
I have been just so impressed by the level of collaboration, the level of cooperation, the vision and the deliberate nature that's occurred here. And it makes me proud to be part of this and have Suburban be part of this, and it makes me proud to be an American.
We all saw the heroic efforts of military first responders and local, state, federal first responders in Katrina, and we've learned those lessons well, and exercises like CMAX 06 go a long way to creating those bonds and relationships that could be needed in the worst of times.
Attention in the hospital, attention in the hospital. This is the drill, mass casualty has commenced. I say again, this is the drill, mass casualty has commenced.
Somebody! Help us!
The exercise entailed the involvement of 8,000 participants, 600 casualties, 8 area hospitals, and more than 40 emergency response agencies. Multi-agency helicopter flight operations employing U.S. Army, Air Force, and D.C. National Guard assets were also an integral part of the 2006 exercise. In addition, the partnership connected with the members of Coyote Crisis Campaign, a multi-jurisdictional crisis response initiative based in Scottsdale, Arizona, to introduce the concept of a remote incident command site. Another key facet of the 2006 exercise involved organizing a Joint Forces Open House along with a disaster training conference. The conference was made up of 40 skills stations and information booths, presentations from world-renowned experts throughout the region, as well as 2,000 attendees. The accomplishments of this distinctive collaboration have resulted in congressionally earmarked funding for the partnership that's designed to enhance emergency management in the partnership's local community and region. Fundamentally, the partnership is one that's built on multi-agency collaboration, integration, and training. It's about establishing solid relationships well before a potentially large-scale disaster occurs.
We're networking. It's about integration. It's about collaboration. And actually, those three terms are what the future of casualty care management is.
This unique partnership is leveraging local, state, federal, and military assets for one purpose: to rapidly provide effective and cohesive medical capabilities during times of crisis. The Bethesda Hospital's Emergency Preparedness Partnership, assuring a sustained response and a model for other communities to follow.